Welcome to The Growing Dentist by Dr. Ali. In this video we will be discussing about tooth decay. Tooth decay, which is also called dental cavities or dental caries, is the destruction of the outer surface of a tooth, due to which there are holes or openings in the tooth. Decay results from the action of bacteria that live in plaque, which is a sticky, whitish film formed by a protein called mucin in saliva, and sugary substances in the mouth. The plaque bacteria sticking to tooth enamel use the sugar and starch from food particles in the mouth to produce acid. This acid breaks down the tooth surface and results in the cavity. Tooth decay is a common health problem, second in prevalence only to the common cold. It has been estimated that 90% of people in the United States have at least one cavity and that 75% of people had their first cavity by the age of 5. Although anyone can have a problem with tooth decay, children and senior citizens are the two groups at highest risk. Other high-risk groups include people who eat a lot of starchy and sugary foods, people living in areas without a fluoridated water supply, and people who already have numerous dental restorations such as fillings and crowns. In this figure, 4 different stages of tooth decay is shown, starting from the most outer surface of a tooth known as the enamel, till the cavity that is being extended to the pulp in the last stage. If your cavity just started, a fluoride treatment may help restore your tooth's enamel and can sometimes reverse a cavity in the very early stages. Whereas, the rest stages might require other treatments such as fillings, crowns, root canals and tooth extractions. Baby bottle tooth decay is also called nursing bottle caries and bottle mouth syndrome. This dental problem that frequently develops in infants that are put to bed with a bottle containing a sweet liquid. Bottles containing such liquids as milk, formula, fruit juices, sweetened drink mixes, and sugar water continuously bathe an infant's mouth with sugar during naps or at night. The bacteria in the mouth use this sugar to produce acid that destroys the child's teeth. The first signs of damage are chalky white spots or lines across the teeth. As decay progresses, the damage to the child's teeth becomes obvious. Brush your teeth twice a day with fluoride toothpaste. Floss regularly. Visit your dentist routinely for a checkup and cleaning. Tell the dentist about any medical conditions you have and medications you take. The Growing Dentist team is always available to help you out with your dental problems.
Thank you for watching this video. For questions or queries, kindly write us in the comment section below. And don't forget to like, share and subscribe our channel for more interesting videos of dentistry.